Dr. Jameema Corneli is a cosmetologist in Kaloor Ernakulam and has an experience of 4 years in this field. Today, Dr. Jameema will share with us on daily skincare routine for a healthy skin. Good evening, doctor, and welcome. We are really looking forward for this session.
Thank you, Sangeeta.
Starting from sunscreen, moisturizer to night creams, what should be our daily skincare routine be like?
Say like more than the skincare routine, the product we select is very important. And now with this Instagram and all this social media, we know lots of everyone using lots of products. Like numerous products are coming on market, and everyone trying it. Each and every product they have to try once in a while. So it's getting our skin is getting exposed to different types of creams and all these face washes, which some are like causing harm rather than giving any best result. So in my experience, I'll say 5 main products are more than enough to give a proper skincare. And those 5 products start from sunscreen, then one moisturizer, and then face wash. Again, moisturizer we need one for our face and one for our body. Then last, our night repair cream. So these 5 are the most important products which we need for a daily routine. And as you said, sunscreen is very important because without sunscreen, our skincare is like always incomplete. I will tell incomplete skincare it will be. So these are the main 5 ingredients that can give you a healthy, good-looking skin, and it will be having no damage and it will rejuvenate it daily based.
Right. So these are the products that we need and that our skin basically is in need of. Doctor, as you said, that without sunscreen, our skincare routine can't be complete. So please enlighten us on this. Why to use sunscreen? Why it's so vital?
Because our skin will be getting exposed to different types of pollutants. And as we know, there are sunlights, again we have UVA, UVB, and even infrared lights. So if you come across, everyone, previously it was just the chronological age. Once we ask them, okay, 30 years, they will be having skin damages according to a 30s. And right now we can see it like before 30s already they're getting wrinkles and small sun damage part, pigmentations and everything. So once we start using sunscreen, they will reduce the sun damage that causing different types of problems to your skin. Again, when coming to sunscreen, we have to choose the right sunscreen. Most of the time patients will be telling, I don't want sunscreen because I'm not getting exposed to that much sunlight. And second, they will be telling that sunscreen causing pimples, and few will be telling that irritating their skin, or few will be telling like that causing powderish or white cast on their skin. This always happens when they select the sunscreen without a good insight into their skin. So always choose a sunscreen with a dermatologist. I'll say, or you can select a sunscreen which is suitable for your skin. So in case you have oily skin, you need a sunscreen in a gel form. So that will not make your skin more oily and that will not cause you any pimples. Again, if your skin is very dry, then you have to select a sunscreen like cream based or lotion based. So there will not be much dryness and much irritation on your skin. Then in case you are going for an outdoor, you cannot reapply it again and again, you can select powder forms, and even spray forms are available. So it's easy to reapply. And when it's always or every time we'll be telling our patients to reapply it like every 4 hours. They'll be telling, no doctor, we cannot reapply. We'll be going to office. It's very difficult to reapply. I can understand. It's coming to occupational side. It's very difficult to reapply. But what happens if you're coming to south, due to humidity, whatever sunscreen you put on your face on morning, it will be enough by afternoon. Due to sweat and all these pollutants, its effect will be gone. So we need to reapply at least before 1 o'clock. So afternoon time, that radiation is high, we can feel the heat outside. So it's very important to reapply. In case you're finding it difficult, now sunscreens are available in powder form and even spray form, which is very easy to reapply.
Right.
So this is the main thing you have to keep in mind before selecting your sunscreen.
Right. So it's very important to choose the right kind of sunscreen as per your skin. And for that, you need to consult your dermatologist.
Yes.
You also said, doctor, that moisturizer is another important thing that we need to have in our daily skincare routine. And you also mentioned that moisturizer, one for your face, one for your entire body. Now, is there any need of using moisturizer regularly? How often? And how to choose the right moisturizer, both for our face, for our body? Please enlighten us.
It's like for body, I will always suggest select this moisturizer in cream form because it's large area, it's easy to spread. And second thing, when you are using lotion form, most of the time, by the time we apply it, it will last for short duration. Whereas when we apply it in cream form, always it's a petroleum jelly based or ceramide based, so it will be lasting for more time, and the duration you don't have to reapply it again and again. And then secondly, I will tell like it's always better to use your apply your moisturizer on a little wet damp skin so that it will seal the moisturize. It will heal the hydration inside, and that hydration will be there for long time. So better apply it on a wet skin than on a dry skin.
Right.
Then for your face, again, in case you have acne issues, it's always better to select a moisturizer non-comedogenic form. So it will not again block your skin or block your pores and make worsen your acne condition. Whereas coming to sensitive skin, we need a light moisturizer without any like active ingredients. Like you can select a moisturizer, calming moisturizer, like ceramide or squalene based. So this will be more helpful for your face. Then I will tell right now everyone will be using their moisturizer. Like the skin is looking dry, before going outside, they will be applying their moisturizer. And every time they will be coming to dermatologist and asking, Doctor, I am applying sunscreen. Again, I am applying moisturizer. So I don't know how to apply it. So I will advise apply moisturizer first, then over that apply your sunscreen. So even the dryness or cast due to sunscreen will be getting masked because of the moisturizer.
Right. So you need to nourish your skin first. So apply the moisturizer first, then use the sunscreen as a jacket. But yes, choose whatever moisturizer you're choosing. Please choose as per your skin type. And again, for that, it's always good if you consult your dermatologist because he or she will be able to actually guide you the best. It's also important, doctor, to cleanse our skin well. And for that, what do you suggest? A face wash, a mild cleanser, or what should we use?
Like, yeah, we have to clean our skin because first after cleaning only we can use all this moisturizer and all this sunscreen, etc. So coming to cleaning your skin, I will always advise there are two types. You can use either a cleanser or a face wash. So that there is difference. Like coming to cleanser, that it will not be having any active estrogen or any active ingredients. So it will just clean your skin. It will clean all the dirt and pollutants, everything. It will getting cleaned up by the cleanser. But coming to face wash will be having any one active ingredient. It can be an estrogen like glycolic acid or salicylic acid, or it will be just to that alcohol based.
Yes.
So sorry, I will be telling acid based. So it's just exfoliate the dead skin, and then it will remove all the dirt and all the sweat, sebum, everything. So if you have a sensitive skin, you need a cleanser without any active ingredient. So it's always better to use cleansers for sensitive skin. Whereas coming to acne, you have oily, already sebum production will be little more, and again we have to remove the dead skins. So we need one exfoliate there. There we can choose active face wash, and face wash will be always like frothy forming stage, and whereas coming to cleanser, it will be mild and not that much forming type. So that's the difference between cleanser and face wash. So again, as I told earlier, you have to get a proper good insight about your skin, and that you will get from a dermatologist. And then only you can choose the suitable face wash or cleanser for your skin. For a rough idea, I can tell like for a oily face, select an foaming face wash, and for a sensitive skin, select cleansers.
Right. So that's the basic difference. If you have a sensitive skin, go for cleansers. If you have oily skin, then go for face wash. And as doctor have very rightly said, please consult your dermatologist first, because then they'll able to diagnose your skin well and guide you the better way. As you have just mentioned, doctor, about the sensitive skin. People who have sensitive skin are so, there's so much happening on their skin. They are acne prone. They are, whenever they are out in the heat under the sun, they have rashes or any other problem. They face so many problems choosing the right sunscreen, the right moisturizer, the right face wash, cleanser, etc., etc. What should a person with a sensitive skin do?
Like, yeah, it's very true. Like previously, when we were doing our post graduation, that time we used to see all the sensitive skin or rosacea type skins once in a month. But right now, weekly base, we are seeing more than 2 or 3 cases of sensitive skin or rosacea. So it's all starts with sunlight. So you have to use the main thing is like you don't have to bombard your skin with lots of product. Most of the time, sensitive skin it happens due to the overuse of product.
Mm-hmm.
So most either steroid based creams they'll be using or they will be using active face washes which again irritating their skin. So it's very important for a sensitive skin to choose the right product. And even their makeup they should select very carefully because there are 2 3 products which lead content which will again irritate their skin. So for sensitive skin, when coming to sunscreen, it's always better to use a gel form. More than lotion form, I will be advising gel form. Then when selecting cleanser, always go for a cleanser, like cleanser, calming cleanser without any active ingredients. Then coming to moisturizer, it should be calming, light moisturizer with ceramides or toluene. Again, that should be non-comedogenic because most of the sensitive skin, they will be having small acne-like lesions. Not the proper active acne, but even then small acne-form lesions are there. So for them, non-comedogenic moisturizer is very important. For night, they don't have to use too many products on their skin. They just have to use a calming night repair cream, which can be either vitamin C serum or even they can use like normal retinol creams that will be again helpful.
Mhm. So don't load your skin with too many products. That's actually going to harm your skin more. So keep it simple, keep it really basic, and all the basic things that doctor has just mentioned. Doctor, talking about the night creams, from what age should we start using them and how to choose it?
From what age to start? Sorry.
Yes, about the night creams, people have this, tendency that there is an age factor in it, and maybe if I'm touching late 30s, early 40s, or even late 20s, we should start using night creams that will do the repairing of our cells or our skin. So, what would you suggest?
There's no age for night creams. As I said, for any age, like even during school times, we from teenage we need some night repair cream. During teenage, if we don't have any particular skin issues, we need one moisturizer for our night. For night time, they can use moisturizers. If they have any acne or any other issues, then they can go for a night cream which exfoliate their skin. Mild exfoliator, like you can start with glycolic acid or even mild adapalene creams are available. Even we can use them. Then coming to pigmentation, like after 30s and all, they will be having pigment issues. In case they have pigment issues, it's always better. I'll suggest them to start with retinol creams or even glycolic acid creams, or even they can go for a serum like hyaluronic acid based creams. I'm sorry, serums they can start. So there is no age for a night cream. It depends on their skin issue. If healthy skin, they just need some nourishing cream for their night.
Right. So it's nothing to do with the age. It's all about your skin and your skin need, and the dermatologist would be the right one to suggest you the right thing at the right stage. As you have just mentioned, pigmentation. We are seeing that, just like sensitive skin, pigmentation problem has become very common. Why it's so?
As I told, I will be blaming sunlight for it. Those who using sunscreen properly, they don't have much pigment issues. And again, now we know all this hormonal, all hormonal imbalance are very common right now. Even
Yes.
from PCOD or even they go to their 30s, they will be having different types of hormonal issues other than thyroid issues or PCOS. So all this will be affecting the pigmentation. Like even we are seeing so many diabetic patients after starting on oral tablets, they're getting pigmentation. So it's just not particular one reason for pigmentation. It's always multifactorial. Like depends on their skin type, or depends on their other internal hormonal issues or other internal issues. That's why. So that's
Right.
the
So,
particular reason for pigmentation. Again, coming to their skincare routine for pigmentation, always go to a good dermatologist and get to understand what's actually the underlying cause, because the treatment depends upon underlying cause. If they have thyroid issues, they have to treat it accordingly. That's why. Even obesity can also cause pigmentation. So all these are very important. Only a good dermatologist can suggest you a proper skincare routine for and a proper treatment for your pigmentation. Again, there are different types of pigmentation. So we cannot just tell them go apply this. That will be equal to a that our prescription right now. Every pharmacy they're treating patients with steroid. Overuse of steroids, they will be getting treated it very fast. They want fast result. So all these pharmacy people, they will be giving steroids, and people will be coming to us after getting a side effect from their steroid overuse. So for pigmentation, never go to any pharmacy for getting treatment. It's always better go to a dermatologist and find the right treatment for you.
right. So if you're experiencing pigmentation, if you could see the start of pigmentation, please don't go to buy any over-the-counter product. Don't go by any advertisements, etc. Please go and consult your dermatologist before it's too late, because the problem will actually, they'll first try to diagnose, see what's the cause, and that will decide what kind of treatment you or your skin requires. As you just told us about pigmentation and how one can diagnose it and why it's important to go to the dermatologist, what treatments are available for pigmentation?
Yes. For pigmentation, initially we'll be starting them with topical treatments, like we'll be giving them depigmenting creams, and then we'll be advising them proper sun protection and all. Later, in case with the topical, in case they have very deep pigmentations, in case they're getting response to topicals but they need something extra, then we'll be going to procedure therapy. In procedure therapy, again for pigmentation, we can treat them with chemical peeling. Then laser treatments are available, and newer techniques like even mesotherapy is also very effective in pigmentation. So these are the main treatment we are using for pigmentation.
Right. You just mentioned the chemical peeling. We know whenever we go to a dermatologist and whenever we, hear this chemical peeling thing, it's quite scary. Scary in the sense that for the name itself, because it includes chemical and includes peeling of your skin. So by the name itself, people get scared of the whole treatment. They don't know what exactly it is. So please elaborate more on skin peeling treatment.
Yes, it's very common. Like when in even in OPD, when we are advising chemical peel for patients, they'll be telling doctor, no chemical. I don't want any chemical on my face. Then second, they'll be telling doctor, you'll peel my skin. It's something like peeling off all the skin. No, I don't want it. Then we'll be telling like, no, it's not anything. Like I'm not gonna put strong acids on your face, so don't worry about it. Chemical peel means we will be using fruit acids. Like coming to lactic acid will be derived from milk. Similarly, these are like fruit acids. So when we are applying it, we'll check your skin type. We'll go through your skin issues, and then we'll select the suitable chemical peels. It's not like in one peel all the issues will be just getting vanished. So we'll start with mild chemical peels, like mild peels which can give you good result in case we are saying, okay, the pigmentation or the issue is little deeper. Next time we'll be using some little bit stronger one. And again, every time patients will be getting scared, like, okay, once I do chemical peel, I have to do it every month. There's nothing like that. Once you get the result, you can stop your procedure therapy and go back to your topical creams. So there's nothing like you have to do it like a weekly based or monthly based. Once, if you are getting the good result with one single chemical peel, you can stop the procedure therapy and go back to your topical creams. And so chemical peel, nothing to worry. We are not going to put strong acids on your face. Okay.
Right. So don't be scared of the name. It's very technical. And the doctors, the dermatologists know how to do it, when to do it, for how long to do it. So just trust them. As we were just talking about the skin peeling treatments, we also know that normally a person would love going to parlor for facials, then going to a dermatologist and consult them for a better and glowing skin. Now, the thing is, what's your take? I would like to know on parlor facials. Are they good? I mean, regular facials will keep our skin glowing, etc. What's the truth?
It's like, I'm not going to tell, like, don't go to parlor, don't do any facial, because it's something like when I joined my clinic, I learned it from senior, like Dr. Meera James. She advised me, like, don't tell them stop doing facial and all. It's a kind of pampering feel. So let them do it, but put that in mind, like it's just a pampering feel. Nothing extraordinary gonna happen. And one thing I will always ask you, don't go for anything like extraction. They will come and they want to extract all the blackheads, whiteheads, and later you'll be coming with like wide open pores and all. So I'll advise just avoid the cleanup part and you can continue your facial everything. That pampering feel, I don't want to take it from you. Let's get rejuvenated with a pampering feel. I think adverse from getting a facial in once in a month or once in 2 months. Just put it in mind like it's not a treatment for your face.
Right. I think that's the thing, it's not a treatment for your face. If you want to get pampered, nothing bad in it, go for it. But please remember, it's not a facial or skin treatment. Doctor, nowadays, I mean, we always knew that vitamin C plays a vital role in, keeping our skin healthy. Nowadays, people are more attracted to the vitamin C serums or vitamin C tablets. So what is the role of these vitamin C tablets and vitamin C serum, and how to use it, when to use it? Anybody can use it. What's the logic behind it?
I will tell like vitamin C, again, all this started with social media getting bombarded with different types of products, especially post-COVID time. We know all Insta page, everyone started selling different vitamin C serum. So I will advise like always go to a dermatologist and get a medicated one for your face, not any cosmeceutical vitamin C. And second thing, yes, vitamin C have important role in our skin. It rejuvenates the skin, but it will never, it's not a treatment that can treat your acne or that can treat your scar or that can treat your pigmentation. So I'll say like vitamin C, you can use it like a rejuvenation cream. Once in a, like not daily based, at least once in a while you can use vitamin C. That's not an issue, but in case you have a very sensitive skin, I will tell avoid vitamin C serum. It's always better to use something calming, not vitamin C.
And okay. Now we know it.
Again, coming to tablets, vitamin C tablets alone, it's not gonna give you that magical result and all. So you can take it. It's really good for immunity, but not like without any doctor advice. I don't advise vitamin C nowadays because I'm seeing like even urology, my friends used to tell like post COVID, everyone started taking vitamin C and there were few issues. So I will say like tablet you can take with doctor's advice.
Right. And there is also a lot of obsession for fairer skin, and for that, people are using a lot of fairness creams for don't know how many years and how long. And so let's talk about those fairness creams. How safe are those? How true is the fact that it will actually make your skin fair?
Yeah, fairness. I don't know how, but we Indians are really addicted to fairness. But I will say more than fairness, I will always suggest to get a good, healthy skin test. The most important thing, more than the complexion.
Yes.
So again, coming to fairness creams, most of the fairness cream outside available in our pharmacies and all this internet and everything, they will be having steroidal content. So more than giving you a good result, it will always harm your skin. Don't use any fairness creams like without any doctor's prescription. Don't use anything. Even for some pigmentary issues, when we are giving you strong creams, we'll always advise like come back to us after 2 weeks or come back to us after 1 month so that we can reduce the strong ingredient creams and we can change it into a maintenance cream.
Yes.
So most of the people they will be telling like I'm using this one is advice from one doctor. Then again once you ask them they will tell like okay that time I went to doctor with some problem and they advised me. Then once I started applying it I started notice like okay my complexion improving, so I'm using it since last 1 year, 2 year, 3 year, like that they will be telling. But after time, once they start getting exposed to sunlight and all without sun protection, they start noticing like their skin getting irritated. There will be redness, there will be irritation, and even few will be coming with pigmentation. So
Right.
don't use any cream without a doctor's supervision. And any fairness scheme that giving you an instant result, make keep in mind that's not good for your skin. That
Exactly.
instant result you are getting because there is something called steroid, and all these steroid creams it will harm your skin.
Right. So steroids are going to harm your skin. Please do not use any fairness cream by yourself. If you have any problem, please go and consult your dermatologist. And whatever skin you have, whatever complexion, whatever way, just keep it healthy. That should be the main motto. We'll also pick some of our viewers' question. A lot of viewers are here. So Advik is asking, what is vitamin C and how does it add to your skincare routine? Though we have already talked about vitamin C tablets and vitamin C serum, I would like to add another thing, intake of vitamin C enriched food. That way, if you can, clarify his doubt.
Yes, vitamin C rich foods are really good for our skin, and again, it will be having a limited dose. So I'm telling like it's good to have vitamin rich food rather than going to all these vitamin supplements.
Right, right. So eating well is always good,
Yes,
then going for tablets,
healthy
etc.,
diet
for
is very
supplements.
important.
Yes, yes. So eating good, eating right is very, very, very important. A Raju is here. Is a new skincare routine necessary when working from home? Now, with all this work from home culture, where this routine of skincare has gone, please tell us
Yes.
about this.
So Raju, it's like yes, you are not getting exposed to sunlight, but you are getting exposed to all this screen, like whether it's mobile or laptop. So there is
Right.
something called infrared rays. So it's like you need to apply your sunscreen because all this blue light or infrared it will be causing skin damage. So it's always good you use a mild sunscreen like gel foam or something because if you have beard area and if even tinted sunscreens are available right now, so it will not cause any powder or that cast feel will not be there. It's very light, very easy to apply also. It's very smoothly gets spread. So you can use a good sunscreen and face wash, but you have to use even if you are working from home because if it's not pollutant but your own sebum will be there on your face, so you have to clean your skin. That I will advise either morning and evening, or either you can use it for morning and night. So face wash is must, then sunscreen is must, and one night cream. If you don't have any that much dryness and all, you can avoid moisturizer. But I will tell sunscreen, face wash, and night repair cream to have to continue.
So even if you're working from home, please take good care of your skin. I would also like to ask doctor, as most of us are now working from home, or this work from home culture is now a very in thing, and it's going to stay for a long, long time, it seems. We also have all the time to experiment with our home available or kitchen available things on our skin. So we do a lot of home remedies, and are they really work? Do they really work? Is they worth of trying? What's your advice on home remedies?
My advice, yes, there are few home remedies which are like really good to rejuvenate your skin. But that doesn't mean you use all your kitchen products on your face. You can use tomato. That's really good to remove the tan from your last vacation or that dryness and all. You can use tomato. And even I will try to tell like please avoid lemon because they're using lots of lemon and they're just harshly rubbing their skin with lemon. And I'm seeing lots of patients with they have irritation due to overuse of lemon on their skin. So I will advise to avoid lemon. In case you want that instant brightness or mild bleaching effect from lemon, you can mix with little yogurt or curd and then use it on your skin. So I will tell like any again that depends on your skin type which mask will be helpful. But if you want a safe mask, I will tell like you can use curd and tomato, mix it together and apply that too once in a week, not daily based. So it's good, but always understand your skin and try all this.
Right. We always say that it's important to know your skin type, and according to that only, we need to use the products. Now, Shruti Nigam is here asking about the same. How do I find out my skin type? How do a normal person know that what is his or her skin type?
Okay, so skin type again, I'll tell you, go to your doctor and get to understand your skin. If you want a rough idea, I can tell you like if you're finding the T-zone, that's the forehead and the middle portion. If it's always oily, then you can tell like your skin is like combination, like not too oily, not too dry. It's a combination skin. If you're finding every time you are sweating a lot and all this under eye area, chin area, and even forehead, every time it's oily, then obviously you have oily skin. Then dry skin, most of the time dry skin they will not be having much issues, but they'll find it like whenever they're applying some sunscreen or any night cream, they're finding it like their lateral area there little bit dryness is there or exfoliation is there. So that's the main three types we can find. In case you have sensitive skin, don't worry, your skin will give you the warning sign. So you don't have to worry about it. It will give the warning sign itself.
It will speak for itself. It will tell
Yes.
you what kind of skin it is. Yes. Doctor, there's also this frenzy of, organic products or plant-based products these days, and people buy them are going and buying them over the counter, plant-based products or organic products. So, are they safe to use?
I read one article that telling like all fruit and organic are not really organic.
Mhm.
Like they'll be writing it like organic if it stays more than 1 month, 2 months at your home. I don't think it's original. So it's if it's proper organic, usually that expiry time will be little shortened because recently I saw one product that expiry date is within 3 weeks. So I think that's original one because without any preservative, if it's staying, it should that expiry should be shorter.
Right.
So I don't think all the organic as they claiming it's not organic, even they will be adding some preservative to it. So I don't think it's safe to buy it over the counter.
Right. And one should not be very, biased about chemicals and or organics. See, we are drinking water, right? Water also has a chemical name. And thus, please don't just, be scared of chemicals. Chemicals, whatever in proportion they are using, if you're using with the right, guidance, then they might do good to you as well. So just don't go by the names. It's organic, it would be good for us. It's chemical, it's going to be bad for us. Don't be biased. Don't be prejudiced with this. Nilesh Singh is here asking, do you really need to wash your face in the morning?
Yes, Nilesh, you have to wash your face. I will tell you, morning, in case, like as we discussed prior, in case you have a dry skin, okay, you can avoid face wash, but you need to wash your face for morning. Of course, you can use a cleanser for morning, and after coming from office or college, from outdoor activity, once you reach back to your home, you have to wash your face with a proper cleanser, like can be a cleanser or face wash according to your skin type. So
Okay, right. Sonia Iyer is asking, when should I moisturize my face?
you, as I told, if you have a normal skin, you can apply moisturizer first and then apply the sunscreen. If you have too much acne and you are undergoing some anti-acne treatment, then I will advise, unless otherwise you are finding it very dry, you can avoid moisturizer. There are particular moisturizers, non-comedogenic moisturizer available in market, which you can apply, but only if you are finding it very dry. Otherwise, you can avoid moisturizer. And for normal skin, of course, you can apply moisturizer daily based, even before going for work. As I told, apply moisturizer, then put sunscreen.
Okay. And Palak Dubey is asking, क्या dark spot के लिए laser treatment सही रहेगा? Are laser treatments going to help remove the dark spots?
It will be helpful, but I will tell, first find out the reason for your, if in case you because there are different types of pigmentation, and in case that pigmentation is due to sunlight, I will always advise the patient to go for a chemical peel rather than a laser. So depends on what is the underlying cause. Dark spot, again, it can be freckles. In case if it's freckles, brown, which on exposure to sunlight becoming dark and all, in that case you can use Q switch NDR laser treatment, which will be very helpful. Whereas if it's melasma like pigment disorders, their chemical peels will be having little better effect on your skin rather than laser. So it's always different. Like it differs according to your underlying cause.
Okay. सुमन यादव is here asking, मैम स्किन को हेल्दी रखने के लिए क्या करना चाहिए? क्या चेहरे पर बर्फ से मसाज करना चाहिए? Is ice massage good for our skin?
Yeah, or again due to Insta, right now the Korean skin routines are very,
Yes.
everyone getting so fond with this Korean skin routines. So
Yes.
some will be telling me like, okay, coconut milk I'm applying on my face, I'm getting acne. So all the skin routines that you should select according to your skin type, and you should select a good product. That also differs, like which product you are using, that's very important. So to get a healthy skin, as I told, 5 main ingredients already we mentioned, and
Right.
sixth one, healthy diet.
Hmm.
Seventh one will be like get hydrated from inside. Or
Okay.
apply moisturizer is important, as well as bringing plenty of water. Like proper hydration is very important for a healthy skin. So food, water, and then our applications that
Right.
can give you a healthy skin.
Right. So apart from those skincare routine, basic 5 things, a good diet and keeping yourself hydrated from inside. That's drinking a lot of water or fluid is very important. Madhuri Soni is here asking, how can I get rid of brown sunspots?
Yes, as I told, brown sunspot, it can be freckles. So, Madhuri, you need to apply sunscreen that will reduce further formation of such freckles. And second, you need to consult a good dermatologist. Get antioxidant tablets can help it, which will be giving you a insight, like it will act like a oral sunscreen. And then I will advise get like proper night repair cream, which I'm not gonna advise you over this. Like directly, I don't want to advise any product.
Right.
So consult your doctor, get the suitable night repair cream for your skin.
Right. So, Madhuri, you're facing a skin problem. Please go and consult your dermatologist. Raksha is asking, how do I know if a product is right for me or not?
Yeah, Taksha. So you have to find out what type of skin you have. In case the product should be according to your skin type. So if the product you are using a sunscreen, as I told, the type of sunscreens are there. There are different types, gel form and lotion form. Again, there are tinted sunscreens are there, non-tinted ones are there. So it differs like according to your skin. So only according to your skin you can select the product. Then second, in case you are getting it like online, I will always advise to find the product directly. Don't go for any online product because there are so many fake products available online. Then if your skin is normal, as I told, you can go for a sunscreen, medicated one, then a cleanser, then a night normal moisturizer. So these three can help you. And if you want to use more better products, then only one advice: go to a good dermatologist.
Right. Nisha Bakshi is here asking, good evening, ma'am. How can I make my face glow every day? Everyone wants to know this.
Okay, so Nisha, you have to use a good sunscreen. So in case you have a oily skin, you have to use a good face wash morning and evening. Then night repair cream, you can use any retinol content or even hyaluronic serums can help you. And then have a good diet and good drink lots of water, hydrating from inside. Then you'll get a glowing skin, which will be there with you for a long time.
Right. So for that, you need to start working on your skin right away. And please don't go and buy anything over the counter or by going, the advertisements. Don't get carried away. Please go and consult your skin expert, your dermatologist before buying anything for your skin. Rita Singh is asking, ma'am, which drink will make my skin glow?
Okay, Rita. In case you're finding any drink that make your skin glow, please inform me. Because I don't know any drink that makes your skin glow. Of course, water. I'll say water can make your skin glow because that will hydrate your skin from inside. But glow on your face with the drink. Sorry, Rita. I cannot.
There is no secret drink,
Yeah,
no magic drink yet. But yes, water
no
is
magic
there.
drink available yet.
Yes, but yes, water is there. It's Alexa. Please keep yourself hydrated. Doctor, I would also like to know about, because people want to know about skin rejuvenation and all the skin rejuvenation treatments that are available. Please throw some light on this.
So skin rejuvenation cream treatments, as I told, chemical peels. There are different types of chemical peels. Almost 35 types of peels are available. So we dermatologists always assess your skin, understand what your skin issues, and select the suitable skin chemical peels. So there are chemical peels which can help you with rejuvenation. If you have dead skin with you, we'll be using the exfoliated type peels, which will be helpful to remove all the dead skin. In case you have a proper, good, healthy skin, but you want to glow it like just like with us saying, if you want to glow it for a special day, you can use glow pills. So glow pills, again, according to your skin type, your dermatologist will select the proper ingredient, and once they combine in right proportion and right way, that can give you a glowing skin. Then, in case you have aging, like wrinkles, aging signs are there, then we'll be using moderate type of peels, which once we combine, that can give you a proper rejuvenation as well as the result will be really good. Like it's effective results we can see. Then other rejuvenation treatments, again, we have different types of lasers available. So we can use lasers for rejuvenation. There are Q switch NDR lasers available right now, and the according to your skin issue, your dermatologist can set treatment for you with laser treatment. Then other than that, hydrofacial right now it's a boom in market, like everyone coming for hydrofacial. Yes, if you have a dull tan skin, of course hydrofacial can be really helpful. Then again, topical creams and tablets can give you proper rejuvenated skin.
Right. So there are so many treatments available, but yeah, of course, as they are treatments, only your doctor can, advise about them and actually do them on you. So please go and consult your dermatologist is like the tagline. It's the key factor, it's the key thing. Don't try anything by yourself. It's going to harm you only and your skin. Doctor, I would also like to know about eye pigmentation. The thing is that we normally apply sunscreen on your face, we take care of your face. But the thing is that eye or the area surrounding the eye is so sensitive that many a times eye pigmentation comes out as a problem. Now, to prevent them, people also start using under eye creams from a very early age because they are available again in the market very easily. So, what is the treatment for under eye pigmentation and your take on under eye creams?
Under eye creams, again, yeah, it's stubborn pigmentation. It will not go away in one single day. Yes. So again, for under eye, we have to use some pigmenting creams and like proper hydrating serums for your under eye area. There are multiple vitamin and growth factor serums available. Again, we'll be using it like proper topical creams we'll be giving you, and after a month, if you are have good result, we can continue with the topical creams. Even peels, there are multiple peels available for your under eye darkness, even that can help you. So depends, like if you using screen for long time, always try to like take a break between, like every 30 minutes I'll ask to stop using the screen and give little bit stress relief. Like don't continuously don't use screens. If you are working from home, you can take a break between, just look around and give a proper eye massage, or even you can take a nap between, not during your work time, but I'm telling like post work time, take a proper good sleep. That can reduce your under eye pigmentation. In case you are using screen, make sure you are using it in a proper lighted room. Those working from home, most of the time they'll switch off their night time and all, they'll switch off the light and they'll use the screen. So that blue rays will be causing more pigmentation. Again, if you are using mobile for long time, like same position, this under eye area, that can cause little bit sagging.
Yes.
So all this will be loosening the skin under your eye. So it's always better to use it proper screen, like in a proper good posture, and don't take break between, and night time use a proper hydrating serums. So that can reduce your chance of getting pigmentation. Once you get the pigmentation, only
the dermatologist can help you then.
And so, again, when you are applying the sunscreen, you have to apply it like near your eye also, like not just over your under like eyelid, just below it. You can spread your sunscreen. And most of the time, people will be avoiding 2-3 areas like ears and neck. They will avoid. So I will advise, like when you're applying it on your face, advise to apply it on your neck as well as on your ear, and apply it under your eye also.
Okay, fair enough.
And good eye makeups. Select proper good eye makeups, because 2-3 makeup products can also cause pigmentation.
Okay, so your skin is, your eye or under eye skin is so sensitive that you need to be really, careful while choosing anything for your under eye or eye area, even if that is your makeup. So please be very wise in choosing the right kind of makeup as well, cosmetics as well. Doctor, now to conclude, what would you like to say to our viewers as a final word?
I will advise for a good healthy skin. Don't go for any complexion correction. Just go towards a good healthy skin. For that, continue using sunscreen. If you don't want to use anything else, okay, but start using sunscreen from today. And when selecting your product, make sure you're using a proper medicated sunscreen. Secondly, other than this 5 ingredients, don't forget good diet, good exercise, and good sleep can give you a good healthy skin.
Right. That was so fruitful, this whole session. And that's the reason, patient visiting Dr. Jameema really comes out with positivity and are very confident after receiving the treatment. Dr. Jameema treatments have benefited many patients. Thank you so very much, Doctor, for your valuable time. And it has been quite an informative session for our viewers. We really look forward for many more such sessions in coming times. Thank you so very much.
Thank you, Dave. Thank you. So stay safe, stay healthy, have a good healthy skin.
And we would also like to thank you, our viewers, for an excellent participation. And for more information and updates on skin health and care, stay connected on our FB page, Beautiful Spotless Skin. We are also available on YouTube, Twitter, and Instagram. Thank you, and good day to all of you.